I thank the gentleman for yielding and also for engaging in this dialogue with other members about the challenge that we're facing to reduce this country's deficit spending and reduce the accumulating debt, and at the same time to make certain that quality, affordable health care are available to all of our citizens. And as the gentleman has pointed out very, very ably, those two challenges are intricately related. In fact, one of the main reasons for supporting health insurance reform is because we simply must reduce our deficit spending and must reduce this country's debt. One of the main contributors to our country's escalating debt is the kind of escalating of health care costs that we've seen in recent years. It's one of the greatest threats to families, to businesses, to the overall economy. Health care has become the fastest growing component of the federal budget, as the gentleman well knows. Last year, health care accounted for 17.3% of GDP. That's more than twice the average of other developed nations. Now, the Patient Protection and Affordable Care Act corrects the failures of the current system without compromising the many strengths that we know that it has. And so it's very disconcerting here in this first week of the new Congress to see our Republican colleagues not only going after the protections in the health care law, but also almost immediately abandoning their commitment to fiscal discipline. Now, the figures that I saw this morning show that the Congressional Budget Office, the non-partisan arbiter of budget decisions for this body, the Congressional Budget Office has said that the repeal of health insurance reform, as proposed by the Republicans, would cost the federal budget $230 billion over the next 10 years. That's a revised estimate, I understand, even greater than was earlier thought. That is an astounding figure. Our Republican friends have made a big show out of their commitment to deficit reduction, but they've made an exception. They've clearly made an exception for the repeal of health insurance reform. So not only is this bad health care, not only would it, for example, say to families who only now are being able to insure their children with pre-existing conditions, no, we're going to go back to the old way, where the insurance companies can deny coverage to your children. What about those families that now are able to include their 24, 25-year-olds on their family policies? No, they're saying go back to the old way, where that wasn't possible. What about our Medicare recipients who finally are going to get some relief from these uncovered drug expenses, the so-called donut hole? They're saying, oh no, you're going to have to once again pay those full expenses. So it's certainly bad policy in terms of health care. But then to add insult to injury, adding $230 billion to this country's debt burden over the next 10 years is, and to do that without batting an eye, without any kind of recognition that this has an impact on the budget deficit, that's just almost unbelievable that the Republicans would be so audacious as to propose this in the first week of this new Congress. And then to add another insult to the injury, they're violating their very own pledge of openness in the way this is going to be considered. I'm sure the gentleman's been watching, as I have, the Rules Committee all day today. It's astounding. Yesterday there was this commitment to open rules, to open debate, to the offering of amendments. Today they're saying we're going to shut it down. It's an up or down vote. Maybe we'll get around later to some of these other questions, some of the repair aspect of repeal and repair. But right now we're just going to repeal it and let the chips fall. That is horrible procedure. It's a shutting down of this Congress before we even start. It's horrible budget policy. It's horrible health policy. It's a very, very bad way to start this Congress. And I appreciate the gentleman for calling us together tonight to talk about this, because we need to talk about it. We need to think about it. We need to fight it in every way we can.
Thank you very much, Mr. Price.